Well, I appreciate everybody being here. We are going to get started. I'm going to share my screen. We've got a slideshow for you guys, as they've mentioned. Be sure to ask questions as needed. All right, guys. I'm going to get going. Let me put this down at the bottom so I can see everybody. Oh, let me go back to this. Can you guys see what I'm seeing now? Chris, are we good?
Everything looks good. Yep, good to go.
Perfect. All right, guys. So I'm going to get rolling through this. So we're going to be talking about wireless and wired scanners today, digital scanners for pediatric dentistry. We're going to get kind of rolling into it. There's a lot of details we have in here. I will kind of shoot to some of the other experts in the field when it comes to like pricing, how to buy, lab stuff. I'm here to talk about clinical applications, like how do you bring this into your office and benefits of it. So a little bit about me. I'm from Bradenton, Florida originally. My practice is right outside of Tampa, Florida in Apollo Beach. Went to Florida State, so still love the Knowles on Saturdays, but love University of Florida Monday through Friday. That's where I did my residency, and I'm a Nova grad for my predoctoral. Currently, this is my kiddos, my 3 kids, and my practice team. We're growing right now, working through an expansion, and we're continually adding new tech, including having this scanner on board for the past couple years now. So objectives tonight, like we're going to understand the benefits of scanning. We're going to look into clinical applications. That's what a lot of docs want to know and kind of get into. We're going to learn how to use the scanner, how easy it is. We're going to learn the workflow with it, so how to integrate it with your lab system and other options we have, and then look at the financials. Like that is big bare bones of what we do as practice owners, so we have to be conscious of it. And we'll hit on all those. If you have any questions pertaining to these particulars that I don't answer, definitely put it in the Q&A, and we'll rock that at the end. So why am I here? Because Chris asked me. No, because I love the product. I've used the scanner since 2023. I have not taken an actual impression in the office. I still keep PBS and a few trays around just in case I need something. But we've been fully digital scan and impression wise since then. It's been an awesome addition, and we'll kind of talk into how we use it clinically in the office. My team has learned to integrate this into the day-to-day workflow if it's needed, and it's even like the end of an appointment. At the end of a recall, we got 5 minutes left, and we kind of are talking through stuff, and I'm like, hey, we can get that scan today. We can deliver it at the treatment in a couple weeks. The team can pop it out, do what they need to do, and get the mom and kiddo on the way and out to checkout with no issues. And then in my office, we want to be kind of at the leading edge of everything tech-wise. Want to make sure I'm using the best materials for my patients, make sure I'm getting the best results for my patients, and in all honesty, making my life and my team's life as easy as possible, because it makes me happier, and I know it makes my team happier, which makes for a better patient-parent experience throughout the day. So the biggest benefit for me is just I don't have to worry about screaming, throwing up 6 to 8-year-olds where I'm taking full arch impressions, where we have a small mouth, we've got trays that barely fit, and nobody likes taking full mouth impressions. And I used to dread those appointments. Now, when I have to do an appliance, space maintainers, any kind of ortho stuff, I don't even think about it because my assistants are going to scan. They do it a lot quicker than I do, and I can do it pretty quick. But I can be somewhere else in the office making money and producing where I need to. It is very easy for them to learn, especially if your DA is a little younger. You're going to have an easier intro on the tech side of things. Even for my more veteran DAs, they're all pros now. It just took a few more reps practicing. We don't got to worry about keeping the alginate inventory or pouring stone or having dirty sinks. Everything is super clean. So our lab space now is a little underutilized in certain aspects, which is great. We have more room for storage and less cleanup at the end of the day. The biggest thing for me is like parents love it. They think it's cool. Like if they've been to an ortho office or something, they've seen it. But a lot of parents haven't. Their dentist is still practicing from the 70s and doing everything old school. So they see that and they're like, oh, this is cool. You're doing what's best for my kid, but it's also like very tech heavy. And the patients are happy. Like doing those impressions, even on the squirreliest, the little kids, is a much easier deal where you can take breaks and not have to worry about something setting in a patient's mouth or not setting or slipping as you're pulling it out and getting getting a bad impression and having to go do it again. The accuracy is awesome. So I've done a lot of appliances through NeoLab and using the scanner, and I have had to resubmit 0 of them. They fit every time. Especially, I do a lot of the 3D printed options that they have, which the impression goes to a 3D printed model. 3D model is then 3D printed over with an aluminum, I believe. Olivia can answer, metal, and it's perfect every time. It seats fast. Don't have to bin wires or do any of those little kind of detailed bird beak bins that you used to in residency or when you were doing your own spacers and or a lab made indirect spacer. So faster chair time. Obviously, a piece of that. We don't have to worry about sitting there for 30 minutes playing with the space maintainer. I try it in, make sure it fits, everything looks good, glue it in, clean up, see you later. I can also be in other spots of the office while a lot of the details are going on. My team makes it very simple for that. And then the turnaround's faster because we don't have to mail things off. We're not worried about things getting lost or having to do some turnaround there. Makes for a much smoother transition. So when we're scheduling that follow-up delivery appointment, it's smooth. Everything is on time, and we don't have to worry about any hiccups. And we used to blame the lab, Olivia, back in the day when we didn't have something on time.
I'm horrified.
It is fully compatible with other techs, which is huge. Like in my office, I use Open Dental for that reason. I wanted the ability to have third-party integration with things, and this scanner makes it very, very simple. Anything that has an STL file capability, you can utilize it for. And I love the indirect banding. We'll talk a little bit about those, direct versus indirect. You place in your own bands, then place in bands, or not using a band that seats completely around the tooth is one of my favorites that I've gotten really on board with. And all of these just make your life easier as a pediatric specialist. So the reason I use the Allied Star, like the main thing for me when I was going into this, I looked at a lot of scanners, used different scanners in school. I wanted something that was pediatric, more specific. So size of the head wise, this does come with the adaptable heads that are smaller for your little mouths. But I like a clean office. I don't like cords. I don't like wires. I don't like tripping over things, which I've done many of times in a dental office. So this kind of checked all those boxes. And I don't like to have to like source my own laptop, talk to my IT guy, make sure that I have all the tech related stuff. I'm a millennial, so I have a little tech background, but I am not very tech savvy. So having all that kind of included with this was very easy. I loved the fact that there was no reoccurring costs in dentistry. That's probably my biggest pet peeve on a lot of companies is they want to nickel and dime you and charge you every single month for something. And this didn't have it. That was a big check in the right direction. My DAs, I make them learn anything, but it was very easy, which was a huge selling point for them when they got it in the office. They clicked around, played with a little bit before they even got their training sessions in and got comfortable with it. And again, it's open architecture, so it's going to integrate with other systems. I do utilize NeoLab Junior for mine. They're very, very seamless to work with, and I've had nothing but kind of good interaction with them over the years. So those were my main things looking into it. But at the end of the day, I'm a business owner. We looked at money. Like that's really what a lot of it came down to. It's like, what am I spending on the unit? What am I spending on a computer? What am I spending monthly? And integrating them into my overhead for the year. And when I looked at this option for the ASC 200E, it was, hey, I have a one-time fee. I'm going to pay for this scanner. I'm going to get my computer. I'm not going to have to keep paying monthly for something because I'll add up like, okay, it's $100 a month. Well, over 10 years, what's that going to be? It's a lot of money. And at the end of the day, they have the 3-year warranty, which makes it even easier. You got some trial room. So if you do have some issues with it, you get that aspect of it, but I've yet to have an issue with it. And it's been seamless. The 2 size tips was huge. Like obviously we can't use adult scanners in some of our patients' mouths just due to size restrictions. So even on like my older patients who have limited opening or gag issues, we just throw the smaller head on. Takes a little bit longer to scan because your field of view is a little bit smaller, but you still get a very quick result and a perfect scan every time. So we just, everybody, we like to look at kind of comparisons. When you're using your traditional stuff, this is what we've all learned in residency, what we all use for a lot of years. We know impressions take a little bit of time, especially if you have to retake. You got a kid that throws up in the chair, now you got to take it out, re-pour, clean up, all of that. If you weren't using an alginate or if you're using alginate, you have to pour up your models. Now you have stone, you got clogged sinks, trimming, dust, all that fun stuff. And then after your assistants get all that done and cleaning it up and getting it sterilized, you're just shipping it out. You're going to ship cost two ways, and it's going to get to you eventually. But at the end of the day, you may have to send it back because it doesn't fit correctly, or you're going to have to bend some wires and make sure that it's sitting in the right spot. With a scan, you're done with less than 2 minutes. Obviously, no model, so your model is 3D. It's kept in the cloud. That's a huge benefit just from a storage side of things, especially if you do a lot of orthodontics and you need to keep those for records. You're going to have no more inventory need. And something that I think Chris brought up to me at one point when we were talking about all this was all those old models you have, you can just scan those and keep them in your system and you can throw them out. So you can clean house and do a little spring cleaning with the purchase of this as well. We all need room in the office for other stuff, and it just cleans some stuff up. You're going to get a real quick turnaround with just that one-way shipping cost. And in general, like if you're just looking at your space maintainers and your normal day-to-day kind of appliances that you're doing, the digital impressions are going to pay for themselves just over a 2-year period if you're just kind of like looking at the basics of what you can do. When we're going through like setting it up, it really is almost idiot proof. Like I'm the bad kind of person when I buy something. I don't look through the directions for use. I'm like, I just want to play with it and see if I can get it to work. And you really can open it up, plug it in, and kind of get it to work. There are some troubleshooting things that you get to learn through as you're doing it. I did a lot of little dental assistant practice sessions in the office. We worked on typodons first, then each other, and they would do this before work, during little breaks, if we had some cancellations, during lunches. A lot of them wanted to play with it. It's new technology, makes it a little more fun, and at the end of the day, gets them very comfortable with it very quickly. Obviously, just like when you're working in the mouth, adjust yourself around the patient, and those are little tips when you're getting in there. And the reorientation is super simple. I remember in dental school, some of them, like if you missed and you didn't get back to that same exact spot that you left, it wasn't going to pick it up. This is just kind of go back to somewhere you know where it was, and it's going to pick it up automatically. You can just keep rolling through your arches. So I think this is where I'm going to bounce it over to Jordan, so he can talk through kind of just like how easy it is to set up, and you guys will kind of see.
So this is just the basic setup here. That's kind of sped up version, but this is the wired version. So I have the software open in the background back there. It's AS Connect. So all I'm doing here, I'm just taking out the little USB, plugging it in, taking the scanner out, this little stand, and then you're gonna plug that in. And so when it comes to like the wireless scanner, especially, it's literally plug and play. And then Casey can attest to like the wireless version. The only difference is instead of that cord plugging into the scanner itself, you're going to have like a little TP link just connect wirelessly. So either way, you would just turn on your scanner, connect it. And then here, all I did was just open up a case. And now we're actually into the scanning software itself. You can see on the bottom right down there. And so that's like the entirety of your setup, but just taking out the box and plugging it in, and you're ready to go.
Yep, it really is that easy. The TP link is like a little USB. You just plug it in the side, Bluetooth to it, and you're ready to roll. Makes it very simple, and laptop's all kind of preloaded with everything, so you don't have to really do too much with it. Yeah. This is just one of my assistants rolling through a scan on a patient, just kind of showing the ease of getting it and see the patient's comfortable. He's a bit of a gagger and has no issues with getting it done. And she's going to do kind of a full upper lower arch. And I think she's going to grab a bite real quick too. Most of your basic appliances, it's going to be a single arch, and you just need the teeth you have on that arch. Some you'll need full bite registration. And this makes it super simple to grab the bite, except you get your upper lower. You click one more button, you have them bite down, you get your buccal corridors, and boom, kind of occlusion's done, and it makes your life a lot easier. aspect of like appliances with this is great, but when you're kind of doing this, you can use this as presentation for parents. Like I do know some docs that will scan every kid at a new patient exam and or recall if there's something going on, because it gives a nice three-dimensional view of the teeth. And your intraoral cameras, depending on how great they are and the lighting and kind of like the spit in there, sometimes it doesn't show the issue as much as this does, because you can kind of move this around. You can show 3 dimensions of, oh yeah, that little black dot on the top of the tooth is actually spread all the way subgingival lingually. And there's this giant hole that you can't see because my hands and fingers are in the way and you don't have the same loops as I do. That's a benefit that we've been using a lot more lately, especially when we're kind of explaining space maintainers to parents. So we'll be like, hey, like we can show you how we take the impression. This is what the arch looks like. You see, and they're like, oh my gosh, that tooth looks horrible. You're like, yeah, that's the one that's getting taken out because there's a swelling next to it. And it gives them a better understanding. And parents really, as non-dental IQ as they are, they do want to understand what's going on with their kids. Being able to talk through where the wires will be, how it'll rest, where the tongue is in relation, or where that Nance button is going to sit on the palate and how it could have an interaction with speech. Just those explanations are so much easier visually with parents when you're utilizing these things. So, but that was it. Like, we should sped up a little bit, but that took 2-3 minutes max. This is another little version of another doc who was working through it with one of her assistants, and they're practicing and they're getting used to using it and kind of getting those reps in. And that's really what it takes. It's just play with it,
stops,
do it.
Go back to an already scanned area.
So you can see she just rolled it back towards the posterior. The box lit back up green. That means it's ready to go. And you just kind of keep going with it. At the end of the day, it's pretty idiot proof. If you're playing with it enough, or your assistants are using it enough, and my assistants use it, I'd say probably every day, but there'll be days where we don't use it, and they might not take it out of the box because that chair didn't have it for a week or two, and we were only using it in like the restorative rooms. But they pick it up and they just keep rolling with it like it was second nature. So once you get it, it's hard to lose the ability to use it. Now, this is kind of what happens after the scan. So traditionally, you're going to do your doctor duty, check your scan, check your impression, and make sure you capture your landmarks, make sure the anatomy is correct, make sure you know where your stuff is going to be seated. At the end of the day, like once you have your templates in for what you as the doctor like in the design of your appliances or your space maintainers, it's in there, and your assistants can kind of plug and chug. Now, you're still going to sign off at the end of it and say, yep, let's send that over to the lab. But once you kind of get these templates all together, makes your life super, super simple. If there is ever a question of like, hey, that's not a traditional impression. Like we took one just the other day on like a partially erupted 19, and we had to take S and T out. And my associate was like, can we do this? And I was like, I mean, we can do whatever we want. They can 3D print whatever kind of little kind of indirect band we need, and talk to the lab. They're like, hey, if you guys are cool with it, we'll get it. That came back looking awesome, cemented just fine. And at the end of the day, it was a little tweak to our kind of lab case, but it was still super simple. It was one extra little step to make something very custom for a patient that needed it, so we could deliver it in sedation and not have to worry about doing it while our little wild one was awake. I'll let Olivia hit on some of this stuff.
Sure, absolutely. So I love this introduction to RX Wizard. It is super user-friendly and it's very intuitive when you're filling out a prescription. Based on the options you choose, actually some options will become enabled or disabled. So you're really guided through this prescription into what you are looking for. You can set up templates like Dr. Lynn was saying. So all of your favorite designs, you can save your preferred options for, but by no means are those set in stone. So you can adjust them as you need to, but a saved template enables you to simply add a patient name, click a due date, and you're done. That's it. Really, really fast. One of the newest options we have is actually integrated pictures as well. So you're able to kind of preview the options before you select them. And then when you choose your return ship date, this is actually a big point for us. Our shipping costs are calculated per box, not per case. So if you have more than one case in the lab with us at the same time, you can have them returned in the same box and actually lower your shipping fees overall, which is great.
Absolutely. anything to save some cash.
Yes, we love that.
This is just a kind of reiteration of different templates. Like if you're doing a lot of habit breakers, you're going to have one for that. You're obviously going to have a lower lingual, you're going to have a Nance, you have a Halterman, you have your Hollies or little spring finger appliances, like whatever you need, you can do. And honestly, the little pictures that you guys included, Olivia, are awesome.
Great.
Because
We're still building them out, but we're excited about them.
No, it really helped. I had a new DA in the office, and she's young. She picked up the scanning super easy, but she was like, "Hey, I need to do this," and I just happened to pop by, and I was like, "I'll help you with it." And in all honesty, like I was just kind of clicking through and hovering over things, and I was like, "Yep, this is it." See, like it's really easy, and kind of talking fake it till you make it sometimes. But it is a very simple kind of interface, and it makes for a smooth intake lab kind of process. Again, 3D lingual arch. It's all kind of templated out at my office because we do these all the time. The 3D printed are my favorite. They fit like a glove, and I love the different coverages you guys can do on the teeth. So I'll kind of walk through what those look like.
Great.
And again, like they send you this little guy. It's kind of like, hey, what do you need? So it idiot proofs your kind of what you need for the appliances for your team. So not everybody is as savvy when it comes to, hey, I'm doing a lower lingual holding arch. What teeth does that include? It makes it kind of foolproof. They're going to look here and go, oh, I just need a full arch, and this one needs the palate, and this one only needs a quarter arch. At the end of the day, like we do a lot of these in the office, mostly space maintenance. We do a lot of mouth guards now. We do some expanders if I want to play orthodontist and stuff, some habit stuff. But at the end of the day, it's all super simple because it's the same scan and it's the same lab kind of intake form process, and the quality of what you get back is perfect. And these are your different band options. I use these 3D SLS printed bands a ton. I like them because they can stay super gingival, so you're not having to kind of push between the teeth. You're not placing seps at all. You can just glue them on. I was very, very, very hesitant as to will these bond with such little kind of circumferential support, but they're micro etched kind of like on the intaglio, and it gives you a lot of surface area for bonding. And we just use Fujisim Ortho Blue, the kind of ortho cement. You can use band lock and it's definitely not coming off. But that's my go-to. I used to always fit my bands, like ever since residency. I want that band to be hugging, and I don't want it fat, and I don't want it slipping. So I used to doctor fit everything, take my own alginate impressions, send them off, and then still have to play with wires and modify things. With the 3D SLS, we just scan it, send it out, and it comes back fitting perfect. There are different prices and different ways of doing this. For me, I'm not going to look at a little bit of a lab increase when the ease and peace of mind and knowing I'm not having to reappoint and that I'm going to have scheduled patients who are production in the office in those chairs at those later dates. It just makes your life a lot easier, and you're not wasting chair time or doctor time. So it's just your comparisons, your traditional fixed versus your 3D SLS. You're still gonna do your normal kind of cementation process, but no spacers because it's just going to go on the super gingival aspect, and it's not going to drop between the teeth. And it is a little more cleansable because you're not going sub G, which is a huge benefit for our patient base. Every kid's mouth is accessible typically. If they lost a tooth, it's usually because of poor oral hygiene. So for me, it does give that added benefit as well when you're rolling through kind of the recalls and seeing what it looks like around there. I have way more issues with band and loops than I do with my 3D SLS fixed appliances hygienically. And this is a 3D scanned band and loop that I did for a patient. This was before the new Smile chairside kits came out. I do utilize those a lot now because they are very simple to use compared to some of the older styles that were out there. But it comes out fitting like a glove and seats really nice. At the end of the day, it's still an option. If you like your lab fabricated, band and loops that you're tried and true and have used for 20 years, go for it. You're still going to get a really good result that's going to fit really nice, and you're not going to have to cut an arm, turn it into one arm bandit. Now, if your patient doesn't show up for 3 months once and space loss occurs, maybe you will. But at the end of the day, it fits really, really nice. And this is just an example of the 3D SLS printed lower lingual holding arch. You can see how like kind of low profile the kind of band that goes on the sixes is. And that's what I love about it. It helps you stay away from thick distal operculums that you can't get down, or if the tooth is just really erupted and you're losing an E and you really need to hold that space, you can get it on there before you could have traditionally put on a full banded lower lingual holding arch, which for me is great. You know, space loss, it's not the end of the world, but if I can do it in one appointment, kind of treatment, cementation, everything at once, and prevent me having to go back and deal with space loss and then kick them to ortho when the timing's right, it's a benefit for everybody. Like happy parents equals happy doctor. And I'm always trying to make them happy so my life is less stressful on the day-to-day. And this is one of the a very unique case that I did. We had to get this tooth out. This girl was a drama queen. Her lower anteriors were not in. Number 19 was actually not in all, even enough to try to do a fancy something. And I was like, I cannot get a band on this girl's tooth. I had to do an emergency extraction on her. She got scheduled like the day before sedation. We got the tooth out and scanned it. And I told the mom, I'm going to make something that I traditionally wouldn't make because of band and loop, obviously, I'm just sticking it to the top of the tooth. I don't have that support. I really didn't know how this was going to hold up over time. This has probably been a year and a half, 2 years ago. When I did this case, it's still sitting strong. It has not debonded, knock on wood, but it allowed me to cement it on a very, very squirrely 6-year-old who would not let me touch her gingiva at all, and convinced her after showing her on the model and then trying it in the mouth, obviously, hey, this doesn't hurt. There's no sensitivity because we're not going under that dirty molar that you have. And it is doing its job. Space is there, not worrying about it. She's becoming a better patient. Mom knows as soon as it debonds, we're going to scan again and get a real lower lingual on there. But at the end of the day, it's holding up great. There's just another example of a kid that would not allow me to cement a full band on the distal of their sixes. I use it for this all the time now. I don't have to wait for impressions. So I will scan. I have made it. I don't know if you guys, can you see my cursor on here? Chris, or
yeah, we can.
Olivia.
Yeah, we can see your black cursor.
Okay, so like the whole distal aspect of the tooth is not erupted, but I want to get a spacer on there and I want to deliver it and get it done while I'm in sedation. And I have had them make it like a 2/3 coverage and say, hey, like drop it on the mesial a little bit more so I get a little more bonding. And it works perfect. And at the end of the day, it holds up well because the bond strength is good with that intaglio of the 3D print. And it's just a different tool in the toolbox. So gives you the ability to kind of think outside the box. As pediatric dentists, we have to, because every patient is different. Every mouth is different. That's part of what makes dentistry fun sometimes, but also difficult sometimes. This makes it fun and easier, which is a benefit for everybody. This is a patient of mine. I met him like this day. He had a bombed out tooth that needed to come out. He was nervous. He was a gagger, and we were like, "Hey, let's give it a go." This is just a video of us kind of going through and scanning. Let me see if that's going to work or not. Yep, there it goes. So I had already anesthetized and got all that done. I think this is going to keep kicking me out. No, we're good. So this is me like kind of scanning the arch, already anesthetized. We got him numb super quick. Got the scan, got the tooth out. He was in and out of the chair within 10 minutes. Like, he was super impressed. Mom was super impressed. He was a heavy gagger, did not gag during the process while we were getting our appliance made. This is me scanning, so I'm not as slick with it as my assistants. But at the end of the day, got all the anatomy that we needed. Made for a super simple process, and we were able to make this family like a lifelong family with us. They had a lot of siblings. For him to come in with an emergency, us to take care of him same day and have him out of pain and have the appliance ready for him in just a couple weeks and deliver it in one kind of easy appointment. As you see, there's blood there from the injection site. Just made it super simple. And at the end of the day, it's going to build your practice in that way. Parents are going to go talk to other parents about that. And I tell my team, and I tell every parent who compliments our office, I would much rather you tell somebody else like you, a parent or a friend in the neighborhood, that how good the office is, over a Google review any day, because that word of mouth is going to drive your practice and build your reputation in the community way better than anything else. This was a lower lingual on a tough patient. You can see soft tissue on the distals. We have obviously bombed K and a maybe restorable T. I can't remember what I did to that tooth, but knew I needed to get at least K out. And this was another one of those kind of 3D printed options with the SLS on the surface, so we can kind of get it out. Now, what I do, if I have the ability with my IV, I do IV sedation in the office. If I have the ability to get an impression done on a consult appointment or at a recall appointment, and I know we're going to sedation, I just say, hey, take the scan, we'll have it. Let's get that case in production so we can cement in sedation. And I do open airway IV with PDAA. And they love the fact that I'm not taking alginate impressions in the mouth and blocking airways anymore. They love the fact that I can cement clean and just kind of keep it really tidy, because I use a light cure kind of cement with the Ortho Blue. And it makes everything easier. There's less airway risk. I'm not in the mouth as long. I'm not holding down the floor of the mouth and blocking the airway as much as a full arch impression would. And for me, it's just less stressful. That makes my sedation day easier. And then I know delivery is going to be beautiful. Now, this is an AI aspect. I'm going to see if this will open up when I click this. It should. See the golf clubs I'm looking at? Chris or Jordan, if you want to roll through this, you can kind of talk through this. This is in your software, and it all comes with it.
Yeah, so this is what's called the AI oral health report. So essentially you take your scan, you throw it in here, AI generates a full-on oral health report for that patient. You can go through, you can edit everything, put all of your notes, everything else. This is all entirely powered by AI. So through your scan and everything else, you can go through here, you can do a bunch of customization, obviously uploading images for whatever you need. And then you'll see here in a second, you'll go through, you can add notes, and you can use your AI assistant to just kind of, yep, there you go right there. So your AI assistant, what's going to go through, kind of do everything kind of for you, and you can go through and edit all of that. So if you don't like the shading that I gave you, you can go through, edit it. It gives you all different shades, highlights, areas that need attention. We'll give you kind of instructions. And then again, you can go through, edit all the notes, but this is a good kind of like, source to another tool to use. You can kind of print this out, send it home with the patient. You can, do whatever you like with it. But yeah, so anything else to add to this, Chris, you might have?
I was just going to add that it's a great tool to assist in treatment planning and having that conversation with mom and dad about what you found, what you're recommending, and it's language that they can understand. It's not too dentistry, not too clinical. So it keeps it in layman's terms where they're able to understand it. And obviously you're working off of a 3D scanned impression as opposed to an X-ray or something like that they're not going to be able to read.
Yeah, really well said. And then you saw there a moment ago, that's kind of like your take-home packet or what you can kind of give to the parent. If you did want to print it out, give it to them or kind of show them.
So really just another tool that you can utilize to kind of give a little more insight into education for parents. And I think like at the end of the day, that's one of the best things you can do is over-educate and not make your life any harder than it needs to be on getting case acceptance done. Because some parents are about that life and others aren't. I'm going to see if I can get us back in our slideshow real quick.
And while you're getting this pulled up, it kind of goes back to as well, like there's no fees or anything else. So that's actually just a new updated like feature and application that was added. There's the most recent one just a couple of months ago. So again, that's all free. It's all, accessible for you guys. It just is going to update without any of those kind of like monthly fees that like Casey was mentioning earlier.
I think this is the wrong version. So I'm going to Yeah, that's not the right one. I'm going to find it.
Look at myself here, Casey.
Hey, you're looking good, buddy. Sorry, I got to find where my presentation is. Now I got to pull it back up. Sorry, guys. You take me to the presentation. There. That's not what I want either. Where am I supposed to go, guys?
So you can end that show. Top
Yeah,
left.
and show on the top left. Or
Yeah, right there, or right there. Yeah.
And then from here,
Go to slideshow.
play from current slide. There we go. All right. Thanks for the IT help. Told you guys I was a millennial. Not that good. All right. So we're going to talk about the nuts and bolts, ROI. Like, how am I going to make my money back from purchasing this? Tangible things that you're going to get right away. You're not going to buy trays anymore. You're not going to have material for that. It's not going to take up space in the office. You're not going to have remakes. That's a huge one. And obviously in pediatrics, we're not seating crowns. We're not doing full mouth rehabs. We're not doing crazy stuff. So the remakes are much less of a thing, but at the end of the day, they still are. If you're doing any indirect lab stuff, you're going to have missed pores, you're going to have misimpressions. And there's a lot of stepping stones, as we all know in dentistry, where something can go wrong, whether it's doctor, assistant pore, lab, or transit, like gets lost, things happen. So you're going to save on those lab fees. The biggest thing for me is chair time, like being productive where you can be, spending more time with your patients and actually like building a relationship with them. Goes a long way. Like that's a huge thing that a lot of us have to work around because in pediatrics, we're very volume based. So if you're saving chair time where you're not in the mouth, you can spend that time if you want to chill in the room while they're doing that 2-minute impression. Talk to the parents, see what vacation's going on, who celebrated a birthday, talk about a new puppy. Those kind of things go a long way. The quick appointments are great. Like we can get people in. If I have scans, and I block a lot of time for patients because we do like to spend a lot of time with the patients and parents. We can book multiple of those in 1 hour in one chair because we know like we're going to get that person in, we're going to get them out. Same on deliveries. Like I don't need to block a full 30 minutes for delivery. It's going to take 5 to 10 minutes on the worst kid who needs a ton of behavior management. Something I did listen to earlier was your 3D model inventory is now digital. So no more taking space up. I had a few dozen old models that I cleaned out when I went into all this. The faster impression delivery is the biggest portion for me. It's like you're getting it done. I used to dread full arch impressions on 7 to 8 year olds, especially the squirmy, fluffy ones who would puke in your chair and cry the whole time, even though we know they were just fine. Now, long term, in my opinion, it like gives you the ability to like jump into new easier. Like you already have the tech you need. The file types you get with your digital scanners are compatible with almost any lab out there. If you want to get into doing aligners, like if you have an STL file, most of them will be able to use it. Invisalign is the only one. We know they have their kind of only iTero use, but Angel Aligners is out there. I use OrthoBrain because it gives me a little ortho aspect if it's a case I don't know as much. But it's giving me the ability to be like, hey, mom, we can do this case. Or, hey, I would usually send this to the orthodontist for that appliance. But guess what? I can take this simple impression. I can get it from NeoLab really quickly. And parents want to stay in-house. So if they don't have to like schedule an appointment at an office they don't know, drive to an area that they may not know and have a delivery at that office. If they can do it all in one at your office, it's great. And be like, hey, we can take that impression. You're coming for a recall in a couple of weeks anyways. We'll just deliver it then. Parents are happier. Less trips for them is a much needed thing if you have kids, and then procedural confidence is huge. It's like I know when I'm presenting this to a parent and talking about how and hyping it up on how easy it is, it's going to be that easy. So that helps a ton, making your patients and parents happy. And then marketing, like highlight this on socials, put it on your website, talk about it on TikTok. Your referring dentists are going to know like, hey, you're up to what can be done in pediatric dentistry. Pediatric dentistry is traditionally very bare bones. We don't need a ton of materials. We don't need a ton of equipment to do what we need to do. But this is one thing that I've loved bringing in the office because it gets me out of my comfort zone a little bit easier. It allows me to try something new or go to a C course and say, hey, how can I use the scanner for that in the office? And get your team excited for new. A lot of people want to continually get ingrained in all the new stuff they see. A lot of my team members are on a lot of dental Facebook pages and TikToks and follow Instagrams, and they're like, hey, like, we should do this and we should do this. Like, they'll give you insight on things too. I follow a lot of those and it gives me ideas. So it's just little things like that get you over that top. So if the basic ROI is just impressions and lab time, this really expands production for the office. So you can make more money on it in a shorter amount of time and make your practice more profitable at the end of the day, but make your life easier in the same time. So you got different purchasing options. There is unlimited training and support. If you need anything, like, they will help you. The New Smile team, the Voxel team, NeoLab, like, I use NeoLab. You can use any lab, but I do prefer using them just because they've been great from day one. Haven't had any issues with them. And their stuff comes out perfect. You can purchase with or without the laptop. I was I want a one-stop shop kind of situation. I didn't want to deal with having to kind of source that or go buy a laptop on my own or make sure I had the right software in there. And then each scanner comes with the 4 large tips by default, but you can get the smaller tips. And I went with 2 of the smallest, 2 of the largest, and they're fully autoclavable. So we haven't seen any real wear and tear on them. We do like kind of cover the tips up before they go into sterile with some gauze so they don't get bombarded directly with everything. But very simple to use. And these are your different price points for the different scanners. You're going to have the wireless and the wired version, and then the tips that are included with that. And then the 3-year warranty is big. Most things don't have a good warranty at all in dentistry. They're always trying to get you to pay for warranties on top of it. But this comes included, which is phenomenal. And that was fast. So we have plenty of time for questions. Obviously, this is your New Smile team with your different account managers and Chris, our national sales manager. Definitely get in touch with them if you have questions on purchase. Get in touch with me if you have questions on use. I've had friends of mine, colleagues from dental school, people I hadn't seen or heard from since dental school, like, reach out to me and they're like, hey, can we chat about this? And of course, like, it's something that I use every day. I'm always available, email super quick, and then phone call. I can always chat after hours on the way home. I got like a 30-minute drive. Always available, open book to kind of sharing what we do, how to troubleshoot things. One of my colleagues called me. She's like, what do I do when I have a bloody tooth? Like, I took the tooth out, and what do you do? And I was like, well, we just place gel foam and have them hold pressure for a minute. And then guess what? Now I can take my impression. And even if there's a little heme on that impression, I don't have to worry about sterilizing it and sending it back. It's perfect. So there's like little clinical tips on how to use it day to day. Go a long way when it comes to that. But at the end of the day, I think, that is it. So I'm going to roll back over here. I'm going to stop sharing my screen.
Okay, so you got to quit putting me on your screen, man.
All right. How do I put me on?
Yeah. Hey, I was going to add real quick. You talked about with the laptop and everything. One thing on there was like 3-year warranty. The 3-year warranty comes included with the laptop as well.
Okay. Oh, okay. No, that's a big specific too. Yeah.
So just wanted to throw that one out there. So looks like we have some questions. Some of these were kind of answered, so we'll touch on them again. But so Dr. John's asking about getting a demo for the office. Let me connect with you afterwards. We'll see what we can do. We have some demo units. I just got to check the wait list and kind of see where we're at with that. I can kind of give you a time frame for what that looks like. So I'll connect with you this week, Dr. John. This one was answered as well. So does it come with the laptop? You have like Casey mentioned, you have the choice to purchase with laptop or without. we highly recommend purchasing it with a laptop. It comes with all the pre-downloaded software, everything like that. 3-year warranties included on it as well. Casey, do you want to talk about, why you chose to go that route, purchasing it with a laptop?
For me, it was really just having to not think about getting with my IT guy, making sure everything lined up, then getting everything updated. I wanted to just like, hey, I plug it in and it works, and it did. Like for me, simplicity is key. When I'm putting new tech in my house or in the office, I'm like, are there other things I need to purchase? Like that's one thing I've always learned to ask a rep of any sort, because a lot of times they'll sell you X when you really need Y and Z for it to work, but they don't tell you how much that's going to cost on top of it. And laptops, depending on what kind you get, if it's a really sick like gaming laptop, that's going to be really expensive. This one comes with like, this is what you need on it. It's not too low, it's not too high, and I thought the price was extremely fair when I was kind of doing my own due diligence prior to purchasing this scanner versus others on the market, just to make sure I wasn't overspending or underspending, because obviously it's purchased for the office, we have to be conscious of overhead, but at the end of the day, this was a very kind of cost effective and easy addition to the office.
Awesome. Next question, Dr. Brian Richards. Can you easily drop those scans into your dental software, or does it stay on the laptop? Have you played around with that?
So I haven't dropped anything into my software. I would think you could, because you can upload kind of what you need, because the file type is easily transferred. We leave it there because the laptop kind of travels around the office with the scanner itself, which has a little cart, so it's easy to move room to room. At the end of the day, it's just an STL file. So I'm sure you could, especially if you got plenty of server space or you got a cloud that you can pump it into and keep it there. That was my big thing, is like, I didn't want to have to take space on my server for anything. So I just kind of keep it on their platform and then just move it around. But looks like, yeah, you can.
Yeah, exactly right. So if you ever did want to do that, just basically, because you can access from the cloud all your stuff from anywhere. So say you have pictures from the intraoral camera or something like that you snapshotted and you want to upload into your own software, you could, access from whatever computer from the cloud. You can just download it on there, then, upload it to whatever software you want. So next question, Dr. Amanda, 2 questions here. Sorry, 3. Question 1, scanner heads, can they be sterilized or are they disposable? So if you want to touch on that again, how you sterilize those.
Yeah, so they're definitely sterilizable. We just take the head off, do our normal little clean down. We don't spray a bunch of cavi or anything on there. Just make sure they're cleaned of debris and stuff. And then we wrap them in a 4x4 at the head, just so where the actual image comes through, it doesn't scratched up or anything while it's going through sterile. And you just pop it in, run it through like you normally would, and it comes out ready to roll. And then I see the other one, like, does this scanner work in office 3D printing? And it does. This is something that I'm getting into with my expansion. I'm building a little lab area so I can eventually bring in 3D printers. There's a lot of talk in the pediatric world now of like, what other options can I do with 3D printing? And for me, this is my way to like, hey, I already have this. How can I change a little bit and open my mind to these newer options? So 100%, like, it's an STL file. That is what's needed with most of your 3D printing software to make it happen. I don't 3D print yet, but I have a lot of ortho and perio buddies that do. And it would work seamlessly with their workflow. I also see I would like Blue Sky, I think, is probably an easy one that it would integrate with. I'm not a 3D printer guy, but at the end of the day, like, I have a buddy that uses that for a lot of surgical guides, and it's like super easy to use and open sourced.
Awesome.
And then Dr. John, can you use this to fabricate zirconia crowns? Absolutely. This is something I almost did the other day, because like, it was a kid that could use a crown, and I was like, if this prep gets too kind of out of whack and there's too structure gone, it's the same exact thing as if you're scanning and sending to your adult lab. So like, say, hey, I want to roll and put a full coverage zirconia crown on this hypomineralized 19. Prep it, make sure your margin's where it needs to be, like, give yourself the reduction you need, scan it, pick through your lab and get it, like 100%. It's the same thing as your iTero or your Meta or anything else that any adult dentist is utilizing in their office. And that's something that I'm like, hey, maybe I should buy some burrs and like, try this sometime, especially on kids that need it. Like we all have kids that need it. And we know like if they go to an adult dentist, they're not going to do it. Like they just don't have the behavior management skills or the patience or the time. So you can definitely utilize that if you want to.
Awesome. Next one here. You can actually probably talk about this yourself. Can a laptop be used for anything else? Have you used a laptop for anything else?
Yeah, I mean, we'll keep our practice management software up on it and use that. So like when we're looking through like, hey, like if there's a note in, like what did we do? So we have the availability to use that. We don't use it on like the day to day as like a static, spot in the office because it kind of travels. And then we can pull up our internet, obviously, go through our different lab functions, get into everything we need to do on the cloud there. So that's what I use it for. I try not to, when I have a dedicated piece of kind of computer equipment in the office, I'm not going to be like, well, now we can use it for everything in the office because I don't want to overload kind of what's going on in there. But yeah, I mean, it's a laptop, just like a normal laptop that you would get, just has the software availability to run everything.
Awesome. Next question. What kind of cart did you place the laptop on? Maybe you want to talk about where you found yours, where you kind of looked around for it, and then cord versus cordless to save money.
Yeah. So for me, the cord versus cordless, it was worth it to not have cords. Like I said, I don't like a lot of cords in the office, especially in my office. I'm really chill. I let a lot of families come with a lot of kids running around, and I'm like, yeah, hey, they're kids. We're in a pediatric office. Let them have fun, especially on non kind of serious appointments. So I went the cordless route. You can save some cash and go with the corded route. Your setup is the only difference, as Jordan pointed out, was a USB into the side of your computer versus your little USB kind of Bluetooth device that goes in. And then the cart, Amazon, baby. I buy everything on Amazon. So I just kind of looked for storage carts on wheels and, picked it up. It was a cart that I had already purchased for our sedation room where we can like move materials over and then put them back in the corner when we don't need them type situation. But very cost effective on the cart. I think the cart was like 30 or 40 bucks, like, nothing expensive. Use your Spark points on there and you get it for free.
Awesome. And then another question from Dr. John. Thank you so much for answering. So when it comes to like spacers, night guards, what else can you use for pedo specific?
More ortho type appliances are like what I use more on a regular basis. If you're doing any RPs or kind of Haltermans or little retainer, hey, I just need a little spring to bump 8 out. It's in crossbite type situation. Anything else you would need from a pediatric use, think of it, it's an impression. Like the best part about it is like, you're not having to fight a kid to take that impression. So you can do everything that you would traditionally do with PVS with this and not have to think twice about it. So for me, it's kind of all of those. My bread and butter are spacers. Night guards, I don't deliver night guards to pediatric patients, but mouth guards for my athletes, 100%. 100%.
Awesome. And then Casey, real quick, could you touch on like how you're using it? I know you mentioned earlier, like kind of using it to show, parents like, hey, what I'm seeing, this is why you may not see this, and kind of as how you use as a presentation tool.
Yeah. So like a lot of times, like I'm big on like patient education, like my imaging software, I have AI in it. So I'm like, hey, this is your enamel. This is your pulp. This is your cementum. Like, this is the dentin. And it gives the parents like an idea of where the caries are and they kind of see relation to the nerve. That helps. But seeing like what looks like a mouth in their face, like on the computer, and to be able to like turn it 3-dimensionally so they can see all aspects of the tooth. So if you have like really weird lesion on like the distal buccal cusp of 19 and it's subgingival and like you can't really see it, but it's a mess. The gums are puffy. The tooth has a hole in it. You can see the black in your mirror and in your loops, but the parent can't see it when you're trying to angle it. When you have that scan done, you just flip the model around and they're like, oh, that's it. Or like when I'm explaining, like if a parent is very, very like, I want to learn more, how it seats on the teeth, where it's going to cover, where that wire is going to sit along like the palate or the lower incisors. That's always going to help kind of just give those parents a little more visual detail on it. That's where I'll pick it up the most. And a lot of parents, I'll explain everything on the AI software on my images, and then I'll show them in the mouth. And then after we take the impression, they're like, oh, that's what you were talking about, because it looks like a real mouth, and it's not an X-ray, and it's not something in a spit-filled dark hole. It kind of lights it up and just gives them the ability for that.
Awesome. I love that answer so much. I was like a person I wanted to hear you talk about that. So I always mention that. Dr. Solomon, not a question, but something I learned from Dr. Casey. I have many teens that play sports. Often they don't come with their parents. Can I scan and then in a few weeks later send them an impression for a sports card if it takes time for a parent to call?
Absolutely. Because you're not submitting anything, you're not completing a code. You can scan, and it's just a part of your patient record in a sense, and it's in your system. So you can just do that and have everything ready to go. Get your upper, lower, and your bite. And the mouth guards from NeoLab come back money. Like I have a hockey player, he had tried like 4 different mouth guards and had a custom one from his dad's adult dentist that he hated, and we made him one, and he like was so stoked. He was like wearing it out of the office for his game that night. Like he was really, really happy. And it fit really nice. And the material is very, very, very nice. So I think that is a very valid thing, Dr. Solomon. It's like, hey, who drove here? Oh, you drove? Okay. Then we can't consent for anything, but I took some pictures of your mouth, and I'm going to hold on to that till I get the confirmation from your parents.
Awesome. And Olivia, I'll chime you in here. I know you showed me some really cool appliances, one of those being kind of night guards, or I'm sorry, like sports guards at AEPD. And I know I brought a doctor over to you who was asking about how does this work? I've never done sports guards before or anything. Can you kind of walk through like what that process looks like?
So actually you have a couple of different options. We do something that's called a mouth guard event as well, where we offer special pricing. So if you get one student and they have a whole team that wants to come see you, that's a really great marketing opportunity as well. And we can definitely support that. But the process would be the same, whether you have one patient or a whole team. Take a scan, submit the prescription. Let us know what color you're looking for, whether that patient has brackets on that we need to be aware of, these types of things. Turnaround time is about 2 weeks in lab. We'll fabricate that mouth guard, and we'll take into account what sport that patient is playing as well. So we do have some really heavy duty mouth guard material for things like field hockey and football and wrestling. And then we have some lighter options if they're less contact sports. So we'll take that into account as well. Fabricate over the scan you send to us or the model you send to us, but we do prefer a scan. We'll fabricate over that scan, print the model, and we'll send it back to you. You're looking at 2.5 weeks total until it's back in your office.
Awesome. Thanks so much, Olivia.
Yeah.
If anybody else has any other questions, please throw them in here now while you still got all of us here on the call, especially Dr. Lynn. I'll give it a minute or two, see if we get any more questions. Otherwise, Chris, Aaron, Olivia, anything else you guys would like to chime in, add at this point?
We did have somebody with their hand raised. I don't know if they had a question, but if you can use that Q&A feature, if you did have a question. Give it a few minutes, see if we have any last minute ones.
My comment, I have one comment. I went to be trained on it the other week and on the scanner, and literally it just showed it to me, talked about it for a couple minutes, handed me the scanner and said, go ahead, scan your mouth. And so I scanned the top, and like you saw in the video, where it's green, you got to kind of go back or whatever. So my upper arch took me about 1.5 minutes just because it was like my very first time I ever had the scanner in my hand. And then he just gave me a couple tips and then did the lower arch in 30 seconds. And I'm not a dentist, and I didn't, I had like 10 minutes of training. So it is really simple.
Awesome. Yeah, that's exactly right. I was there. I watched that whole thing.
It's true.
So I got a few more questions. So Dr. Martin asks, Olivia, how do we get in contact with you? How do we get pricing information?
Very easy. Send me an email, olivia@neolab.com, and I'll send you over a pricing list and get you introduced to our customer service team who can get you started if you're looking to get started. Otherwise, you can give our customer service team a call. I think their contact information was on the presentation as well, and they can certainly send you a price list as well. So either of those are really easy options, and I'll get it right over to you. Actually, looks like there's another one for me next.
Yep. Dr. Richards. I'll just say this one out loud just so everybody can kind of hear. But Olivia, does your lab just do appliances, or do you also do partial flipper type appliances?
So yes and no. So we're full service ortho, but we do have dedicated pediatrics. We do some flippers, but we don't do like full partial dentures. So if you're looking for a tooth or two on a flipper, yes, we absolutely can do that.
Perfect. And then this is one Dr. Amanda asked, is there in-office training with purchase? There's not in-office training. It's a virtual training you'll have with the Voxel team. Casey, if you want to talk about what that training experience was like for you and your staff.
Yeah, like Voxel will set up a time to walk through everything with you on how to get in the software, how to open it up. I told you I didn't do that, but my team did. I wanted them to have more of a formal training. Super easy to work with, super easy to get in contact with them. And they'll give you everything you need to get going. Like there's not a lot that you need to do learning wise to understand how to use the unit. In a sense, like it's very simple to plug in and get going. It's simple to learn to take the impressions themselves because it's visually intuitive. At the end of the day, it's more for what you're going to do with it. So like, okay, hey, what am I doing day to day? What can I punt to this technology right away and dedicate to it and kind of get inventory out and take time out of the office in that sense. And then everything else is just icing on the cake, like how you expand use of it.
I'll also add to that. I mean, the training and the support is unlimited. So you have a warranty, a 3-year warranty that comes with for the unit, the scanner itself, and the laptop. But all of your training and support is included. It's unlimited. You can contact us. You can contact Voxel as many times as you want. We're here to help.
Yeah, and I'll attest to that. Like if every stepping stone through my career and working with New Smile and the team, like even if they didn't have unlimited support with things, like they're going to help you. Like anytime I've reached out to anybody with New Smile, they're like, oh, you need a little tip here or how to do this. They're not going to say no. They want their people happy, and they know their stuff, and they know their stuff is good. So it's usually a very easy kind of training in that sense. So just reach out to them. They'll help you guys out.
It's one of the advantages too with the getting the laptop that's turnkey, right? It's turnkey solution. So you have that pre set up, everything's already set up for you. You don't have to worry about that part. But when it comes to training and support, you're actually able to get remoted in via that laptop with a standard laptop that you build with your IT person or something like that. Voxel and New Smile don't have that connection to be able to do that.
I think we're good for the night. I appreciate all of you joining us. Thank you so much for spending your evening with us. If you have any questions, anything whatsoever, reach out to myself, Chris, Aaron, Dr. Casey Lynn, and then Olivia as far as the lab side goes. So anything else anybody would like to add?
I'll just remind everybody, be on the lookout for the survey to get your CEs via email tomorrow. And then just a reminder that this webinar is recorded, so we'll have this posted on the New Smile site, typically by the end of the week. So you can go back and watch this as many times as you want.
Exactly right. Awesome. Thank you so much, everyone.
Thanks, everybody.
Thanks, guys.
Thank you so much.